for a positive psychology intervention for social anxiety disorder. The aim of this report is to explore the use of the positive psychology approach of using signature strengths and exposure therapy as an intervention for social anxiety disorder. The prevalence and impact of SAD for the general population and for the target group will be discussed. Current treatments that are being applied to treat SAD and their efficacy juxtaposed with the justification of why a strength-based approach shows merit in pursuing. This report will also give a brief outline of a strength-based intervention designed by me, why it is needed and what the limitations are. Social anxiety disorder is the marked fear, anxiety or avoidance of one or more social situations where individuals believe they are exposed to negative judgment and scrutiny by others. It impacts on functional impairment and mental distress levels, which impacts on quality of life and economic productivity. It is one of the most prevalent mental disorders in the world. In Australia, the 12-month prevalence is 4% and lifetime prevalence is 9%. Asha Ansani and Ad-Durk 2017 found that women are 1.5 times more likely to meet the diagnostic criteria for social anxiety disorder. The young are also more at risk of SAD with a median onset age of 14.5 years. SAD is highly associated with comorbidity with other mental disorders like major depression disorder and PTSD. Brusco et al. In 2008 posits that people with SAD avoid seeking treatment, which is in line with the symptomology of SAD, i.e. avoidance and fear of negative evaluation. There are many etiological pathways of SAD. The Spence and Rapey 2016 model suggests multiple risk factors that can interact and increase the likelihood of developing SAD. 3 categories were established: genes, temperament, proximal factors like poor social skills and poor social performance, and environmental factors like parental influences and negative life events. Cognitive behavioural therapy is the most common therapy used for anxiety disorders presently. However, there is increasing evidence that traditional CBT is less successful for SAD. Acceptance and commitment therapy and exposure therapy are showing some promising results in treating SAD. Positive psychology interventions aim to cultivate positive feelings, behaviours, or cognitions. A strength-based approach is a key positive psychology principle that has a basic intent to help people flourish and be their best selves. Character strengths are the positive parts of your personality that impact how you feel, think, and behave. The strength-based approach of using signature strengths invigorates rather than exhausts the individual. Identifying and then using your signature character strengths have shown to enhance health and well-being and buffer against mental health issues like anxiety and depression. In fact, signature strength interventions have more empirical support for the reducing depression and anxiety than any other generic strength-based interventions. Using one's strengths can provide pathways and a sense of agency to achieve goals, which in turn provides optimism and hope for an individual's future. This is consistent with the framework of hope theory, which describes self-efficacy beliefs based on levels of hope. Higher hope is consistently related to improved outcomes in psychological adjustment. Snyder, 2002. Hope can be engendered in people by practicing solution-focused conversations and activities. Studies have shown that social anxiety negatively correlates with hope levels, and underuse of signature strengths are negatively associated with social anxiety. Schuet's 2018 meta-analysis found 7 signature character strengths interventions that had significant impact on decreases in depression and anxiety. Using signature-based interventions is associated with higher hope outcomes. The intervention will be a longitudinal randomised controlled design with repeater measures at 4 time points: pre-treatment, post-treatment, after 3 months, and after a year from treatment. It will be a self-guided computer-based intervention. The intervention will use a person's signature character strengths in a novel way in public speaking exercises to increase self-efficacy and hope levels in the aim of preventing or reducing social anxiety disorder. Combining virtual reality exposure therapy with the utilisation of character strengths, the subject will be provided with 4 different levels of public speaking exercises, which will be repeated 4 times per week for each level. Each session is to last 30 minutes. This will be a graded approach consistent with typical exposure therapy. The levels will range from typically low anxiety-inducing scenarios like talking to your family at a group gathering to higher anxiety-inducing environments like making a speech to strangers in a public forum. The target group will be kids aged 12 to 14 of parents who have been previously diagnosed with a mental health disorder, as this population are more at risk of developing SAD. The median onset age of SAD is 14.5 years, and it's been established that less than 4% of the population will be seeking treatment in the first year of onset of SAD. Comorbidity is associated with SAD, making prevention even more critical. First day participants will complete the general self-efficacy scale, and the Beck Youth Inventory will be used to assess baseline anxiety, and the Snyder's Children Hope Scale will measure baseline hope. Suitable applicants will progress to the Values in Action Strength Inventory for Youth Survey test, which will be used to identify candidate signature strengths. Participants will then be encouraged to use aspects of their signature strengths in a public speaking exercise simulated on a computer program. Optimizing signature strengths has been shown to increase self-efficacy and lessen social anxiety disorder. Exposure therapy is also associated with improved self-efficacy. Bandura, 1998, states that low self-efficacy leads to anxiety. There can be high attrition rates in online studies, which might be a limitation of this study. Privacy and confidentiality issues may arise with online programs, and negative effects have been reported in internet-based treatments, as stated by Botecher et al. In 2014. Also, another limitation is online program development for virtual reality exposure therapy. Signature-based interventions may be expensive to develop. Thank you.